This day is called the Rotary Family Health Day. To simplify it, it's basically an integrated service delivery initiative where all health services are brought under one roof. Over time, the Rotary initiative has been making sure that it goes out on outreach services to make sure that you bring services that are not easily reachable by people. Right now, you know that this clinic is one of the overpopulated clinic that is serving the most underserved population of the informal settlements in the greater part, the southern part of the Free State. So this day basically brings all those services under one roof in one day to provide integrated health services. Rotary is an international initiative. They get money from international, donors, especially focusing on areas of HIV, AIDS treatment. We are beneficiaries of that as the Department of Health because their organizational expertise, their ability to organize, their networking services, but also their ability to bring us together. Even those services that we do not have, they mobilize them that we have them, but we don't only have them for one day. It's a network of a relationship that goes on over time beyond this day. So we are quite happy that we're having them here today. The event is graced by the Deputy Minister of Health. You've got the Rotarians as well. Yes, Paget is here. You have the MEC of Health, and over the next three days, you will be having this initiative going to let's say the whole area in the informal settlements, and then on Friday they will be going to Butsabe. So these are the underserved areas. We're making sure that they amplify what you already do in the province already, making sure that we take health services to the people. But the specific area they've identified is an area where we underperform the most. The premature babies that are born in the province because of illnesses, sexually transmitted illnesses that are often suffered by women and men as well, which impact on the unborn babies and the HIV status of people. So we are quite happy to have them here today, just to make sure that they strengthen and amplify our ability to provide healthcare services to the underserved populations.
Okay, my last question, just perhaps your brief answer to this question. You may have touched on what I'm going to ask, but usually when such things happen, we understand that perhaps there may have been a case study to study the particular area and how the government brings in services. If I may ask, was there a particular study or research which was done to this area, especially this community, to then bring the particular services to this community?
Yes, this clinic does an observation of the trends of the people that come here, the trends of the under 5, from 0 to 5, the newborn babies, their ability to live beyond 6 months, 3 years, 5 years. And we are aware that we are not doing well. For instance, most of the babies are born as under 2,500 grams, as opposed to 2.5 kilograms to about 4.5 kilograms. So you will be aware that many people are catching syphilis as a sexually transmitted illness that needs to be treated in pregnant women as well. So we need to look into that. That research drives our plans and the ability to respond to healthcare trends.
Thank you very much.